Okay, we're going to continue with Chapter 37, Part 2, the child with a visual or neurodevelopmental disorder. Visual impairment. The occurrence is usually a common problem during childhood. In the United States, prevalence of blindness or serious visual impairment is about 30 to 64 per 100,000. Refractive errors occur in about 5 to 10% of all preschoolers, and it's identified through vision screening programs. So we have classification. There's partially sighted as school vision, acuity of 20 to 70 to 20 to 200, and they can see normal size print. Then we have legally blind, the acuity of 20 to 200 or poorer, and legal blindness is not a medical diagnosis, just a legal term. Possible causes could be prenatal or postnatal infections, retinopathy of prematurity, trauma, postnatal infections. Other disorders such as sickle cell disease, juvenile rheumatoid arthritis, and Tay-Sachs disease can cause issues with visual impairment. So the visual acuity test. Vision testing is discussed in Chapter 29 if you want to review it. And the assessment of visual impairment includes to identify children who are at risk. You want to observe for behaviors that indicate vision loss and screen all children for visual acuity and other signs of ocular disorders. So look at box 37-6 on page 1099 of your textbook. So for visual impairment types, we have refraction, that's bending of light rays through the lens of the eye. We have myopia, that's light rays fall in front of the retina, causing nearsightedness. And then we have hyperopia, and that's light rays fall beyond the retina and causes farsightedness. Plus we have strabismus and amblyopia, which we'll discuss further. Okay, strabismus may or may not be refractive. There is a deviation of the eyes, and it may result from muscle weakness or paralysis. Treatment depends on the type of strabismus, but often includes patching a good eye or wearing glasses, and it may be treated with surgical intervention. Amblyopia is also known as a lazy eye. There is a reduced visual acuity in the affected eye. It's treated with corrective lenses, and it may be corrected with laser surgery. Look at pages 1098 to 1099, box 37-6, types of visual impairment. I want to talk about eye trauma. Eye injuries are a common cause of blindness in children and are an emergency. Injuries may be to the eyeballs or the adnexa. There's penetrating. These are sharp instruments or propulsive objects, blunt objects, that tends to happen during motor vehicle accidents. Then we have non-penetrating. These are like lacerations, blows to the eyes or the heads, or even burns. Treatment is aimed at preventing further damage, and you want to look at table on page 1099. Look at the table for emergency eye injuries. Okay, so talking about care management, you want to do the nursing assessment, identify children who are at risk, observe for behaviors that indicate a vision loss, screen all children for visual acuity. Nursing alert, suspect visual impairment in a child of any age whose pupils do not react to light. Nursing goals and care, promote parent-child attachment, promote child's optimal development, encourage independence, promote play and socialization, provide a safe environment, provide reassurance during all treatments, orient the child to their surroundings, encourage independence. Treatment team members should be consistent, safety counseling for preventing eye injuries, and periodic screening of all children. So education can include Braille. It may be helpful for education, but not for communication with others because many are not able to read Braille. Audiobooks and learning materials are for children with vision impairment. Look at pages 1100 to 1102 of your textbook. So when we talk about hearing and vision, most traumatic sensory impairment, it has profound effects on development. Motor milestones usually do become achieved. Other development often do delay though. Development Future goals for the child with the parents to help them deal with possible alternatives to home care in the future is the goal. Okay, retinoblastoma. It's the most common congenital malignant intraocular tumor in children. There's 11 cases per million every year. It affects primarily children younger than the ages of 5. It's caused by genetic mutation or it is inherited. Clinical manifestations, look at box 37-7 on page 1102 of your textbook. The cat's eye reflex, that's a white reflex that appears on the lens that appears when light falls on the tumor mass in the eye. So treatment is complex. It is enucleation, irradiation, and or chemotherapy can be used to decrease the size of the tumor. The use of chemo in advanced stages has not been shown to improve survival rate. Enucleation is the treatment of choice if there is extensive disease and no chance for useful vision. You want to look at figure 37-9. This is a child with a prosthetic eye. Prognosis is with early appropriate treatment. Survival rate is about 95% for both unilateral and bilateral tumors. Children with bilateral retinoblastoma, this is the hereditary form, are more likely to develop secondary cancers than children with unilateral disease. So for nursing care, you want to involve parents in the preparation for diagnostic and treatment procedures and prepare parents for what to expect post-op and post-op care. Well, let's talk about autism spectrum disorder. It's a complex neurodevelopmental disorder accompanied by intellectual and social alterations. They may have verbal effects. It's repetitive and restrictive behavior patterns. It occurs about 1 for every 100 to 150 children, 4 times as common in boys. It's a genetic disorder of prenatal and postnatal brain development. It could be immune and environmental factors that interact with genetic susceptibility. It's relatively high recurrence rate in families with one affected child, and there is a strong genetic evidence among twins that suggests that it may be actually have an autosomal recessive pattern of inheritance. So diagnosis is often delayed until the ages of 2 to 3 years of age. Diagnosis is made based upon criteria listed in the DSM-5. Causes unknown. Scientific evidence suggests that there is no link between the MMR and autism. Educate parents regarding this research data. Immunizations are important. Clinical manifestations. Peculiar and bizarre characteristics primarily in specific areas such as socialization, communication, behavior, difficulty with eye and body contact, language delay. Not all children with autism spectrum disorder will exhibit the same manifestations. However, speech and language delays are common in most children with autism spectrum disorder. Prognosis, it may be severely incapacitating condition. However, some children improve with speech and language therapy and socialization or communication with others. Treatment and nursing care. Numerous therapies used behavior modification and providing a structured routine that can help to decrease the unacceptable behavior. Autism often becomes a family disease. Parents frequently express guilt and shame. Stress the importance of family counseling. Refer to the Autism Society of America as a good source of information. Children with autism spectrum disorder may be managed at home or in a long-term placement facility. This concludes Part 2 of Chapter 37.